Through this short video, I am going to discuss rare scenarios where the quest for restoring sight turned out to be life-saving. The surgeon hits the bull's eye. Wondering what am I actually talking about? I am discussing lenticonus, which is an abnormal conical protrusion of the lens due to thinning of the lens capsule. There are two types of lenticonus: anterior lenticonus, which is commonly associated with Alport syndrome; posterior lenticonus, that is usually seen in Lovis syndrome. When we talk about Alport syndrome, it is a rare genetic disorder involving mutation of COL4A5 gene that encodes alpha chain of type 4 collagen. Type 4 collagen is common in lens capsule, corneal Bowman's and Descemet's membrane, internal limiting membrane and Brooks membrane of retina, cochlea, and glomerular basement membrane. Hence, this forms a triad of glomerulonephritis, sensory neural hearing loss, and eye abnormalities. Most frequent ocular manifestations being anterior lenticonus, dot and fleck retinopathy, and posterior polymorphous corneal dystrophy. Diagnosis is usually clinical: slit view showing bulging of anterior lens capsule and retroillumination showing the oil droplet reflex. But where is the bull's eye? Anterior lenticonus presents with increased refractive errors like the case seen here, showing more than -20 diopter of spherical with more than -5 diopter of astigmatism. Along with this, high amount of negative spherical aberrations are seen, which resemble the bull's eye pattern on aberrometry. Treatment of choice is clear lens extraction with intraocular lens implantation. Based on the refractive profile, either a monofocal or toric intraocular lens can be implanted. The challenges during surgery are posed due to highly elastic and fragile lens capsule that is prone to high risk of peripheral extension. Let us watch a video where the surgeon is performing phacoemulsification in an eye with anterior lenticonus. After making a clear corneal temporal tunnel and two side ports, the surgeon proceeds with initiating a continuous curvilinear capsulorhexis from the center of the anterior lens capsule. But owing to the highly elastic and fragile capsule, the rhexis could not be taken further. Hence, the surgeon now decides to take the rhexis paracentrally. Using a 1/2 scissors, a tangential cut is made in the mid-periphery and the rhexis is completed using Utrata's forceps. Hydrodissection is done and phacoemulsification is done. The cortex is then washed using coaxial irrigation and aspiration. A monofocal foldable single-piece intraocular lens is implanted in the capsular bag. Now, I would like to bring your attention to the post-operative outcome showing improved aberrometry profile and good refractive correction from as high as -20 diopters spherical with 5.12 diopter cylinder to as low as +0.75 diopter spherical with -1.62 diopter of cylinder, giving the patient a good quality vision. Now, do you think it is a cakewalk? No. Let us see another similar case where phacoemulsification is being performed and a similar kind of struggle is noted during capsulorhexis. The rhexis is now being taken from mid-periphery and completed using Utrata's forceps. We can now appreciate an intact circular capsulorhexis. The surgery is then continued uneventful unless during the cortical cleanup, when we can see the intact capsulorhexis tearing. This shows that the fragile capsule can open up any time during the surgery. Despite the challenges, the surgeon went on to implant a toric intraocular lens in the bag, as the torn area of capsule is away from the axis of implantation. Why is this topic so important to discuss? The patient not only suffers from a decreased visual acuity, but higher order aberrations trouble them more than imagined. Clear lens extraction in these cases would help to improve the quality of life of the patient. Not only poor vision, anterior lenticonus is also associated with serious systemic illness. Owing to the poor quality of vision, the patient most of the times presents to the ophthalmologist first. Hence, it is our responsibility to detect, treat, and promptly refer the patient. Early diagnosis and treatment can not only restore the vision but also save the life of the patient. Thank you for watching.